So after we finish oral and maxillofacial surgery, many doctors they become dentists, they become oral surgeons, they become general dentist also. Very rarely they go into the exclusive surgical practice, orthodontic surgery, trauma, cancer and all. Me no, I didn't go into the cancer trauma and I went to the implant direction, but you went into the oral cancer direction. So how it happened?
I didn't went alone to cancer alone. I had 5 pseudopods of mine.
Okay.
So like one was with, I told you another one more great teacher, Dr. Raja Sundaram. Now he's the CEO of Aishwarya Hospital.
Okay.
He's a man who trains me like anything. So any cases, I'll be there next to him. So when I was finishing itself, I was much more than what a few of my taught people, I wouldn't say teachers, taught peoples. I was much having a great hand with them. The second one is a great friend of mine called Dr. Karthik. He's a fantastic plastic surgeon. Above that, along with Rajasundaram, we have Dr. Anthony Aravindan, Dr. Shivram Bharatwaj. They all are microvascular surgeons. So they told me you had to go to another one more center to learn your microvascular and other things. So I was going into that also. I was always hungry enough to eat anything and everything which comes in my way because my cup was always empty. So I was, craving for all the knowledge what the all people can give it. And the third one is for aesthetics and other things, Karthik's help was there. The fourth one for the implant, I have another one more good friend, or my senior would say, Dr. Ganesh. He's a man who took me to Germany, to Steenberg University for implantology and other things, which you know very well.
Okay.
And the last one is to the University of Vienna, where Society of Oral Laser Academy has taught me about laser and other things. So as you said, orally a oral surgeon we can be, or a maxillofacial surgeon, as well as a dentistry, because I don't want to have a very narrow-minded saying that I'm a maxillofacial surgeon, I'll only do this, do that. No, whoever comes at any site of or any level of the stage, I want to attend. I want to help the people in a very different way. So when you are addressing, you said a lot of cine stars and other things. The problem with me is not just the cine stars or the serial beautiful actress or so. Even a vegetable vendor near my area, a milkman. Every day morning I go, I just wish them and they also wish me. Even they don't wish me, I wish them, because they all were my patients. Even the auto drivers, they come and leave the patient, because being normal has become very costly affairs nowadays. So I was always on to the ground that I don't want to fly high with a lot of different people, because I know somehow or the other few people only can make friends. If it's going to be more than 2 or 3, it's going to be gang.
Okay.
A friend can be only 1 or 2 max, nothing more than that. So my cup was empty and has been filled half, or I would say, or maybe a quarter, I would say, and still yet to get filled by all your knowledges. But I don't want to, narrow myself that saying that I'll do only this, do that. I'll tell you an incident if you have a time.
Yes, time.
In the COVID peak, I've decided not to practice for a month or 2.
Okay.
Suddenly a call came, see, they were speaking in a very different language, because we South Indians, they always think that we can talk all multilinguistic thing. We have our own limited, knowledge about Hindi and other things. And furthermore, north you go, it's bit a Greek and Latin only for us. They said, I want to come and see you, my child, help. I said, okay. Then I came to the clinic, we reopened the clinic and sterilized everything, we called. It's a very small baby of 8-month-old baby, had a mucormycosis. Half of the lip has already been eaten by mucormycosis.
Okay.
The parents, they came and they were sitting in the clinic. Then I asked, who told you, who referred you? It's a word by mouth could able to reach from south to northeast.
Okay.
Then we should feel proud of ourselves, and we can tap our back and say, yes, you have done some good things in your life that it has reached till there. It's an 8-month-old baby, so immediately we had some organization, other things, somehow we cumulative fund and other things, we have taken it up, and off of the lip has been already, necrosed.
Okay.
It's 8-month-old baby. So for feeding gingivotomy and other things, we have to call a gastro. See, my contacts has been beautifully, I always try to be in everybody's good books. When a help needed, these people, they came, they gave a feeding gingivotomy. And systemically, when we are about to go for systemic fungal, antifungal and other things, there was a hepatomegaly. So they said, no, we can't. So then the mind for mucormycosis is an infectious thing. What is there for me to do with the cancer or aesthetics? And this is a very severe infectious one. That too, it is a infant, not even a child. So that is again the fifth sort of what I was telling you, the laser. So they said that no, we can't give it. If it's going to be a hepatomegaly, we can't do it. Then I said, why can't we try this LLLT, low-level laser therapy for mucormycosis? I tried it. Somehow after one and a half week, I have a protocol which we both have taken a patent right for that. That vanished, and the patient is so happy. I have got a lot of the consultation fees and other things. One of the best consultation fees what I've got is the kiss from that small little girl. So nothing could able to still fulfill me. Some people say I earn 20 lakhs, 30 lakhs and 30 lakhs in a day, and all that doesn't come even closer to that small kiss what that baby has given. So that day I realized that yes, I have become a better doctor in the world. So I don't want to constrict myself into a very smaller field. So it's a huge one, huge people. There's still a lot of people doesn't have that great help. It's just not pan-India, it's just pan-world we are supposed to talk about. That is how, when there is somebody who can help the people start coming to us. And that is how, we can bring lot of discovery to this world, which will be a very great help for the humankind. So that's why we both have given that patent rights as a open source. So that's the instance. So I don't want to get constricted myself or shelled out in a...
But these five like octopus you are telling, so each thing is helping in some other way, they are connecting everything.
Correct.
Yes.
Correct.
I think you have treated, I think meiosis, no?
Yeah. Usually in Europe and other places, they consider that in third world country only the meiosis comes. Yes, of course, we have a lot of flies, that's why it comes. There are two categories, I would say. There is a tertiary people who can't even use their hand or something like that to, fly the fly away or so. Second one is mentally challenging kids. Okay. So these are the two kids I have been fully documented. Okay. There was a mentally challenging kid came to our clinic, and he was trying to express something which we couldn't able to identify it. I had a friend in vet. I always, chuma funny, we used to speak with him. We used to say, see, you fellows will at least hear what the problem is, so you can address it. But for veterinary, it is very difficult. That was sparking always in my mind. Yes, it is true.
It's something similar, yes.
Yes. And there are few mentally challenging people also. We all are social animals only, and they cannot express that. And how do you do it? That kid came and he was doing his finger like this, a creepy effect.
Okay.
Then everybody said, no, nothing. Then I had a small doubt, and I called the baby and I just made him to sit. And the moment I opened, I could able to see some 1,000 to more than that maggots, full of maggots. And everything in the oral cavity, and it was moving. I was like, oh my God. See, since we have only read in the books and other things. After that, when I was in Adaya Cancer Institute for training period, at that time, in a forehead flap I have seen. That is the only time I have seen. After that, in my own clinic, I am seeing it. Because see, we have aesthetics and other things in a beautiful clinic. Suddenly, you see a huge amount of worm, more than 1,000 inside your oral cavity. Everybody will be taken back. So I just want to remember another one more or two more beautiful teachers in Adaya Cancer Institute, Dr. Mani sir and Dr. Ravikannan. When everybody is going out, that is the time you should go in, because you also doesn't do the treatment. Who will do it? He used to ask me. I said, okay, we're going to treat the patient. We called the anesthetist. I said, you have to put him down in the GA, we'll take it out. Okay. He said, no, GA, it's not possible. Oh. He has mild pneumonia and other things.
Okay.
Then if we pour turpentine oil, if the patient is going to swallow it, it's again going to be a huge amount of pneumonia and things. Instead of taking out and helping him out, we may put him in a huge danger. So again, we applied the same laser and other things. So when I went and presented this in University of Vienna and other things, they were like, Because the Europeans have not seen maggots only, because it's a very cold country, where in the cold country the flies cannot survive. That is the main reason. It's not that India is very, I would accept it, but not to that bad level. So they were like, how did you treat this? How did you had the idea of even using laser for this? I said, we have to apply it somehow or the other. When everybody runs out, we are the fellows who should come in to help. When we don't do it, who will do it? So that's the first case of mydriasis, about a mentally challenging kid. Then it was a history. A lot of patients started coming to our clinic, and I make sure that all the homes of these mentally challenging kids and other people, especially the oral cavity, the flies are the main enemy. So we have even formed a protocol for that, and we have given to a lot of homes. I've told you, I don't have only the huge creamy crowd. I deliberately, I just want to, go and mingle. You will see the love and affection of these autism kids and other people. It'll be great. It's like a small 2-year or a 1-year kids, how they come and they they shower the love and affection. Same way, you just imagine 30-year a boy or a girl will come and they'll hug, and they will they will shower, because they are into that mentality. That gives a huge amount of satisfaction that we still humanly we are serving a lot of people. The second one is the tertiary cancer patients. So this is again one more case. Somehow a patient of mine has seen that type of a case. I was doing it, and in the TV it runs and other things, right? So they called me and they said that, doctor, there is a severe cancer patient who has been treated, but somehow huge worms I could able to see in his neck or something. Would you mind? Oh, of course, you bring him in. So they brought him. Same way. This is in the neck area, not in even the oral cavity. It is very still more a worst or life-threatening, because the carotid runs there.
Okay.
So again, we called the anesthetist and other things. They said that no, the carotid is very close, dog. We can't do anything. Even putting down is also an issue. I said, well, then what next? He said, it's a tertiary patient. He has to. I said, no, that cannot be done. Let him die at least peacefully. So let my hand help him, if possible, by the God's help and my teacher's blessing, all my friends' help. So again, we use the same laser and other things. Again, when I went to Vienna, they called me. I was just showing this. They said, how many cases do you have these type of thing? I said, how much of a cases? The edge cutting technology is not just for the creamy layers. It's for any Tom, Dick and Harry in whichever status or level or creed or crad, other things. It has to reach everyone. That was into my brain. So I hope I answered your question for that.
I think it is the first time the laser is used for maggots.
Correct.
This time.
Correct. Maybe a lot of people might have done, but documented, we are the fellows who have documented it.
Okay.
And these protocols, there is a beautiful author called Jayaganthan. Jayaganthan. So he has written a book called Yane Doctor, means elephant doctor.
Elephant doctor, yes.
So in that, Dr. K is a man who has given a protocol for the domesticated elephants, how it should go to the forest and should, like that. Some fellow who may be looking like a very cranky or something like that, but these are the fellows who give a beautiful protocol which will take the human being at his position. So that is what our motive should be, was my humble thought.
Yes. Actually, that elephant doctor story, it is not a story,
it's a real one. It's not a story. Correct.
It is about a forest.
When we all went to Topslip, we have seen him.
Yes. He is a real person.
Real person.
Many hundreds of elephants are affectionate
wild elephants.
Wild elephants.
Not just wild dogs were also being treated by this gentleman. He's a very great man, Dr. K. By this, the podcast, people has to go to such places and see, not just the humans are treating humans alone. Humans, get into the wild and they could able to even see a wild in a very different eye. It is going to make a mark in the wall for all those people,
Okay. So I have read a study which tells cancer patients are more prone to depression.
Yes.
So, but more than that, the cancer surgeons are more prone to depression and psychiatric illness, this kind of thing. So, what is your take on it?
I told you,
because they are seeing the sufferings, death, everything.
People always think that doctor means, these fellows are lion-hearted, they have an eagle eye, they always compare with the animal to us. But the truth is, we are also same humans, but we studied medicine. That's the only difference. My worst hit I would say is when I went to Adaya Cancer Institute, 3 departments there, radiology will be there, surgery will be there, and medical onco will be there. So medical onco, sometimes my teachers used to go, you have to go and visit those kids also. So lymphoma, leukemia and other people will be there, no? So I went there. At that time we are very young doctors, right? When I was walking, one small little girl called me and she said, "Hey, come here." I said, "Hey, with respect." I said, "What respect? You come here." I was like, "Who the hell are you, man? Little brat, you're calling me like this." And she said, "Oh, you come, you won't even get a chocolate for me. Why should I buy a chocolate for you? Tomorrow when you come, you buy chocolate and come. Otherwise, I'll tell you, chief, that you are not working properly." I said, "Oh my God, who are you, man? You're a small little prince or little devil?" And I said, and I thought, okay, good, we have to buy some chocolate just to impress that sweet little girl, no? So next day I went, the bed was empty.
Okay.
Then I searched here and there. Then the staff nurse, she came and she touched me and she said, "What? Where's this little girl?" I asked her. She said, "Yesterday night she passed away."
Okay.
So that was, see, this is for all the doctor or the people who see. I cried for about 1.5 hours sitting there.
Okay.
Then the sister came and she consoled me. Just imagine a huge fellow like me sitting and crying like a baby in the ward. And I still remember that staff nurse saying this, "You will get used to it. Don't worry, you can't stop this, but you will get used to it." So I got used to it, but still we treat the patient, we treat all the patients. You just imagine which doctor is going to make a worst treatment or worst surgery for the patients. We always want our patients to be getting the best treatment because we get a good name, we get money, we get a lot of patients from them. We all work for money, but we don't work only for money. That is the take. The doctors, every time they take a knife and when they cut open, it's not that their heart is going to be at ease. That will pump more blood than what the patient is going to have anxiety. But we get used to it and we know how to suppress the cardiac, saying that this is nothing, we are going to help the patient. Psychologically, it is always a heavy pressure for all the doctors, which none of the media or the people or the patients, yes, of course, few people, they really understand. I would always appreciate them, but we go through a lot of stress. Nobody understands, our family or parents, or except the professional people around us will understand what is it. Till the magic happens, saying that, no, don't worry, everything will become all right. These 2 words will make the patients, psychologically, it will become a very great medicine for the patients. At the same time, we will be tapping ourselves and we say, nothing, we are going to treat it. This is how we have to go about. Because we know there are few inoperable cases, but if you don't do it, say for example, last time I told you, a huge tertiary stage cancer patient came.
Okay.
So few of the time they would give morphine and other things, and they will slowly, peacefully. But that shouldn't be our aim. We have to help the patient in whatever the power we have. That is what the ultimate goal. Whether it is a vegetable vendor or a milkman or a watchman or an auto driver, that doesn't count. So we all have come to a level that humans can be beautifully treated. That's the ultimate aim for psychology, I would say.
So coming to the cancer, nowadays more younger generation is getting cancer. When I was visiting New York, there was some posters, childhood cancer awareness campaign they are conducting. That means there is a lot of why it is happening. Is it happening? Are you?
I would say or start with one single word. People may even scold me for this, but every day morning you get up, you take a plastic brush, a plastic bristle, and a paste contained in it is a plastic. The second one, what we do is you go and have a drink of water, a glass of water. So that is also from RO, reverse osmosis. Everything is made of plastic. Then after that you take a milk, you cut it open, you put a coffee, plastic. Knowingly or unknowingly, nanoparticles of plastics has been inculcated into every human being, not just one or two, every human being, other than people who live really happy inside the mountain or the deep village people, because they are the most healthy. I'm not saying village means nothing low. I'm telling they are the most highest privileged people, I would say. I would say we have to step on to that level of understanding, because those days I still remember it will come in a glass bottle, the milk. The moment it has been shown in the plastic, obviously you would say in the city the cow eat the paper and other thing, they say obviously we also eat the plastic in a microscopical way. So what do you expect if you eat plastic? It is obviously a nanoparticle of a synthetic one goes inside your body, and you expect a Samsung TV to come out.
Yes.
This is a huge one. Already in ocean, the animals have started showing that enough is enough. They are pushing it out, and eating even the the seafood and other things also. We know when they could able to get it, we are also going to get it. Few people here they used to say you put a mosquito repellent. When the mosquito could able to die small celled insects, obviously we are also going to have it in a small cell way of reaction. So I wouldn't say that it's a cancer which has been evolved and it is coming into a very different. That is one, I would say etiologically we could able to say that is one of the reason. But the major, I would say, we have gone deep into the plastics, and coming out is going to be a very, very great problem. And we are going to face more and more amount of these type of diseases. When we talk also, I would say that we have never used any earth pot or anything like that. So we are also, the air condition, anything and everything, it touches the, the plastic, and then on latent heat principle it comes, the AC works. But still, the plastic has been inhaled, exhaled, incubated, inculcated. But see, whatever it's going in and all the words, it is the main factor, I would say. And the second one is when you have all these things, we don't have a great food what our grandfathers used to say, or what our grandfathers used to eat. Obviously, when you don't have a great nutrition, the nation is going to face all this problem, and it is very difficult also now to, I would say our use of word is irreversibly, we have damaged it, and we are damaging it. And irreversibly, we can never go back to the normal, provided we take meticulously heavy steps.
Drastic steps.
So, yes, we have to live in this society with this. One day or 2 days we'll talk about the plastic, and the third day we'll start using it somehow or the other. So, it has become inevitable.